The health reform law has been on the books for 3 years. Unfortunately, now is when employers and their employees are going to start feeling its very worst effects. Beginning in 2014, employers with 50 or more full-time equivalent employees will be required to provide affordable, Washington-prescribed health insurance to their full-time employees and their dependents. This employer mandate is forcing many small businesses to restructure their entire workforce, to lay off employees, to put off plans to hire new workers, or to move full-time workers to part-time status.
98% of our employees are full-time employees, and that's by design. We want our employees to have great jobs and to have benefits to go with those jobs. But the cost, the way the plan stays today, would almost force us to go to part-time employees to reduce the costs that our customers and us cannot afford.
Employers and employees will also face limited choices under Obamacare. The law now mandates that health plans offered by small businesses cover a specific package of benefits, or so-called essential health benefits. Despite the promises made, people and businesses will no longer be able to choose lower-cost, more moderate plans, and now will have to pay for more extensive and expensive soup-to-nut coverage.
Even more troublesome is the fact that if I do offer health insurance, I may face steep fines because of the complicated formula with the new law, which restricts my ability to offer coverage to the employees on terms that I can afford as a business owner.
The implementation of state health insurance exchanges, or marketplaces, is yet another source of frustration and anxiety for employers and individuals. While some states are setting up their own exchange, others have elected to let Washington run a federally facilitated exchange. And still other states are moving forward with a state partnership model, where the exchange will be operated jointly by the state and the federal government. No one knows for sure how these marketplaces will function.
We see this kind of confusion all the time. Even now, before exchanges are in place, people can shop online. They just don't buy online. I get calls from small business owners all the time who say, I've been looking at plans, but I'm not sure which one is right for me. It's not like a pair of jeans. You can't return it if it doesn't fit.
And then there's the issue of affordability.
It's going to be a significant cash drain on the company, as our cost of providing health care will go up by nearly 400% as a result of the mandate and the ensuing penalties. And that'll pull an enormous amount of cash out of the business, which at a minimum will prevent us from opening 5 locations, creating 528 jobs, or investing over $26 million in new capital over the next 5 years.
It's clear that the law hasn't accomplished what its supporters said it would. It does nothing to control costs. In fact, the opposite is happening. To truly reform our healthcare system, we need to do 5 important things. First, we must expand access to affordable coverage and care. Let's strengthen the private healthcare marketplace, give employers and consumers flexibility and choice, and allow small businesses and individuals to more easily form health insurance purchasing pools that give them greater purchasing power. Second, we need to strengthen quality and innovation. Doctors and hospitals should be paid based on their performance and outcomes, and consumers should have access to providers' performance records. Third, improve citizens' health. Employers must have flexibility to promote employee wellness, and healthcare providers should be rewarded for improving health, not just treating illnesses. Fourth, we must reform Medicare and Medicaid to save them from bankruptcy. Beneficiaries who can afford it should pay a little more for the care they receive, and states should be given greater flexibility to run Medicaid. Finally, let's control our rising healthcare costs by fixing our broken medical liability system, deploying health information technology, and attacking fraud and abuse. Please, to learn more, go to our website. Thank you.